So prolonged exposure therapy requires a bit of a more detailed response because it is focused on primarily treating avoidance. And avoidance is a big aspect of PTSD that is responsible for many of the symptoms that someone with PTSD is experiencing. What I mean by that is when somebody is engaging in these types of avoidance, because it can be so difficult to think about or to be reminded of these traumatic events, someone can naturally find themselves wanting to avoid thinking about these traumatic events or being anywhere that reminds them of these traumatic events. So they tend to avoid more and more things and become more isolated. It makes sense that a person would try to do this because if they're avoiding, it feels like it's going to make things better. But in reality, that increases the severity of the symptoms of PTSD. And the reason I bring that up is because prolonged exposure focuses on reducing that avoidance. By reducing the avoidance, that's one of the most effective ways of treating PTSD. And prolonged exposure does that through two types of exposure therapies. The first is called Imaginal exposure, which involves a veteran or active duty service member in this case, focusing and narrowing down what their most traumatic event is and talking about that event many times in the session. So we do that over the 2 weeks. We'll be able to do that for about 7 or 8 sessions or so. And even though that can be very, very difficult, because it's not easy to talk about the most traumatic event in your life, by doing it enough times, it starts to get less and less difficult to talk about these things. And then by doing that, the severity of the symptoms starts to decrease. So that's the first part, is the imaginal exposure. The second part is called the in vivo exposure, which means in real life. And the in vivo exposure is focused on finding environments that the veteran or active duty service member has been avoiding, places that they used to go to in the past, but now they don't want to anymore because it reminds them of the trauma and leads to an increase in their symptoms. So we want to develop what's called a fear hierarchy, which is figuring out which of these environments cause them the least amount of distress and the most distress. We want to start with the easier ones, allow the veteran to spend somewhere between 40 to 50 minutes in those environments. And of course, that can be a little difficult to do at first too, which is why we try to start with the easier ones. And then similarly to the imaginal exposure, the more that a person spends time in these environments, the easier it starts to get for them to spend time there without experiencing the distress that they have been experiencing and that's been disrupting their lives.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.